As we all know, kidney disease is a very serious disease. It can occur in many ways and it can cause many problems in a human body. So naturally, many people will be having many misconceptions related to kidney problems. Let's go ahead and hear about few misconceptions which anybody and everybody can relate to the kidney problems. First misconception is that a kidney problem is not a serious problem. You will be surprised to know that kidney problem is a major cause of death all over India and the world. Only a few kidney disease can be cured, but only if they are caught on time. Most of the kidney problems and kidney disease lead to kidney transplant, and if the kidney transplant is not given, it leads to death. As in a kidney problem, the progression of the disease is very fast and very problematic. Another misconception is only one kidney is damaged in kidney failure. But in reality, both kidneys are impaired. Normally, even when a kidney of a patient becomes absolutely bad, the patient does not have any kind of discomfort and there is no change in the amount of creatinine and urea in the body. But when both kidneys go bad, the unnecessary waste of the body, which is cleaned by the kidneys, does not come out of the body, due to which the amount of creatinine and urea in the blood gets increased. An increase in the amount of creatinine and urea on examination of the blood indicates kidney failure. There is one more misconception that swelling in the body in any kidney disease is a sign of kidney failure. But in reality, in many diseases of the kidney, swelling in the body can occur due to several problems. And in most of the kidney problems, the swelling don't even occur. Some patients do not get swollen even when both the kidneys are on dialysis and are on kidney failure. In brief, inflammation is seen in most patients with kidney failure, but not all patients. Some patients do not have inflammation even in the late stages of kidney failure. Another misconception is all patients with kidney disease should drink large amounts of water. In reality, low urine output is a major important symptom found in many kidney disease. Therefore, to maintain water balance in such patients, it is necessary to ban water. However, patients who are suffering from kidney stone disease and urethral infection are advised to drink more water. Some people also think that I am healthy, so I do not have kidney problem. In reality, a person suffering from chronic kidney disease gets no symptom, and therefore anybody can suffer from a kidney problem. Some people think that my kidneys are fine now and I do not need to take medicine. In many patients of chronic kidney failure, treatment reduces the symptom of the disease. Some such patients stop the medicine on their own under the illusion of being healthy, which can prove to be dangerous. Due to lack of medications, there is a fear of kidney failure and the patient has to resort to dialysis in no time. One more misconception is if the amount of creatinine in the blood is a little higher, but if you feel well, there is no need to worry or for the treatment. But in reality, this is a very wrong idea. Many types of kidney disease can cause damage to the kidneys, so nephrologists should be consulted without any delay. In patients with chronic kidney failure, the amount of creatinine is seen to increase only when the performance of both kidneys has decreased by more than 50%. So did you see how few misconceptions can alter the state of mind of many kidney patients? But if you are suffering from a kidney problem, you need to consult a doctor from Ayurveda. Ayurveda has been treating patients with chronic kidney problems for many decades. Let's go ahead and meet a patient.
Namaskar दोस्तों. Today we have with us one of the famous personalities of Bangladesh. May I know the patient's name?
Mustafa Jaglul Wahid.
Okay, and he's your?
My husband.
Okay.
I'm Anju Kapoor Wahid.
Okay. So what was the issue that you were facing when you first visited us?
Actually, about 6-8 months back, he started with severe cough, and we did not know that time that he had little higher creatinine, and we didn't know that the cough can be related to that.
Mm-hmm.
So when he took the initial medication and he started some Ayurvedic cough syrup, the cough was not reducing for almost about 2 months. That's when I went and saw a specialist, a chest medicine doctor, and I told him and I showed him all his reports and that he'd had a 2 transport and he's under some medication for his heart and he's under some medication for his creatinine also. So that is when the doctor told me that his cough is due to his creatine.
Okay.
And he said that when you went to the doctor first, you should have mentioned to him that he had high creatine, and he would have treated him in a different manner. That's when it was a big realization for me that my husband needs proper care. And then 1 month later, his cough reduced and he was better. But slowly he started losing his stamina. He had very bad, he had no appetite at all, and he used to feel nausea. And the moment that started, I took him to a doctor in Dhaka, because those days we were in Dhaka. I took him there and the doctor put him on some medication. He gave him something for the nausea to stop, and he gave him some medicines for his heart, for his creatine, for his urea level and his potassium. And he also took care of, I think he had parathyroid, which is also high. So he said, I won't bother about it now, let me cure this. But for some reason he gave me about 10-12 tests to do.
Okay.
He said, do the echo, do this. I was not very happy doing it in Bangladesh. So I told my husband, let's go to India. So we went straight to Bangalore. I went to Majumdar Hospital, then I went to Narayan Rudralaya, then I went to Manipal, and all the doctors, they said that he's almost on the borderline to start dialysis.
Oh.
That's when me and my brother, we thought about it, and we saw about 4-5 doctors in Bangalore for Ayurveda. And one doctor, she was a general Ayurveda doctor. She told him, okay, so you have to have a strict diet and I will cure you, and you need to do this for 3 months and come back to me. But then my brother did not agree. He said, no, I don't want you to take some medicine there. Then he started looking at the YouTube. Then we saw you on the YouTube. And that's how my brother, then he said, no, as he specialized in the kidney, you go there, let him see him, then you all take medication, don't take otherwise. So then immediately, and I think the same day, I sent you all the reports, and I came here in 1 week with my husband. And we started your medication. We took back from here. We did take a week and a half to start the medication because we were traveling, and it was hectic for us to start immediately. There was a lot of khana to make, Then we started the medicine on the 7th of April, and we continued it till, we're still continuing it. And by God's grace, we found that his test about 15-20 days back, his creatine level had reduced a little bit, and EGRF was not so much improved that day, and his urea had gone up. And I guess he had little curds because we were traveling at that time. And he had little bit of papaya, little milk and all that. So then immediately I sent you those reports.
Okay.
And the same minute you called me, you were just a call away after my reports were sent, which I appreciate. And you called me and you said that you have to change the diet, stop his milk, stop his curd. And you said that to take extra care, don't give him raw papaya and the ripe papaya. And then you followed it up with a new dietitian chat. And then I started giving him that chat.
And things were improving now.
Yeah, then after that, just 2 days before, which is today we are on the 9th, on the 6th of July, we did his test. His creatine has come down from 4.35 to 2.89.
So did you see how the knowledge of Dr. Puneet Dhawan and Karma Ayurveda treated this patient's chronic kidney problems very easily? We hope you like this video. Please don't forget to like, share, comment and subscribe. See you in the next video. Stay healthy, stay happy.